All right, it's 12:02. I think we'll get started. I'm Ron Sokol. I'm a professor of pediatrics and the principal investigator and the director of the CCTSI, the Colorado Clinical Translational Sciences Institute. And I really appreciate you all joining us today for an update, a town hall meeting on where the CCTSI is in February of 2022. And also we'll discuss our future directions as well. I wanted to thank Wendy Meyer, who you've just been listening to, speaking to me for helping set up this webinar, for all her great work with our communications and marketing team for the CCTSI. And Tim Lockey, our Director of Finance and Administration, and Janine Higgins, our Director of Operations, will also be joining us later for the question and answer period. So let me jump into this right now and start. First, I wanted to quickly explain to you what the Clinical Translational Science Award program is. It's an NIH-funded large grant that is designed to fund institutions that are called hubs that'll be part of a national consortium of research institutions that will collaborate to transform how we will be performing clinical and translational work nationwide. Currently, there's approximately 60 funded hubs. Many of them have multiple hospitals, multiple universities like ours, so it's actually probably 3 times as many institutions are involved nationally. And CTSA grants are really designed to provide many local resources, facilities, research personnel, pilot funding, regulatory and informatics support, biostatistics support, education, training program, and research units for major biomedical research institutions. And the branch of NIH that funds this program is called the National Center for Advancing Translational Science, or NCATS. The CCTSI, Colorado Clinical Translational Sciences Institute, is the name for our CTSA hub here at Colorado. It was originally funded in 2008. We've been refunded in our 5-year grant cycles twice, in 2013, 2018, and in 2023. We're up for another grant cycle. The grant funds much of what we do, but I must say that there's much institutional support that allows us to have the broad programs, which I will be speaking to in a few minutes. The CCTSI is designed to support all faculty, postdocs, and trainees who are involved in aspects of clinical and translational research. And our CTSA involves 3 universities and 6 hospital partners. The CCTSI is disease agnostic. That is, we don't have a theme, a priority, a major focus. We are designed to support all outstanding research. And again, our grant and our organization helps fund infrastructure, facilities, education, training, resources and services, et cetera. And I do want to go into this in a lot more detail here shortly. So the vision of the CCTSI is to accelerate and catalyze the translation of innovative science into improved health and patient care. And we do this by achieving it through our mission, which is 4-fold: to catalyze and enhance discovery, innovation, dissemination, and translation across the lifespan, to educate a resilient, innovative, and diverse translational science workforce, to promote and ensure an efficient, safe, collaborative, and integrated research environment, and also, and very importantly, to engage stakeholders and communities across the entire translational spectrum. So, in a sense, we're all about collaboration, innovation, and translation. And when we speak about the translational research spectrum, what we really mean is the advancement of basic scientific discoveries through to finally patient care and population health, and then improved global health as an ideal end result. And people talk about different steps of translation, T1, 2, 3, 4. We actually have added T0.5, which is translation to natural animal models through our colleagues at Colorado State University, but also then translation to humans, to patients, to practice, and to population. And very importantly, translation in this sense is bidirectional. A clinical observation could lead to a preclinical study to understand a disease mechanism and vice versa. Collaboration is also key, and we emphasize team science. This shows you the institutions involved. CU Boulder, Colorado State University, and UC Denver are the three universities involved. Also, all of the health profession schools, medicine, nursing, dentistry, pharmacy, public health, and the graduate school on the Anschutz campus are involved, a number of community organizations, NCATs, and then our 6 hospitals that are associated with the medical school, UCH, Children's, National Jewish, Denver Health, the VA, and Kaiser Permanente. And finally, we work through our various technology transfer offices and business development offices with industry to collaborate as well, particularly regarding product development. So this is, in a visual sense, all of our institutions that are our partners. We also, though, have membership, and I encourage you all, if you have not, to become a member. It's easy. I'll show you how in a few minutes on our website. But if you want to partake in any of our resources, funding, training programs, etc., we do require you to register as a member. And as you can see, we have just continuous growth in our membership. And most recently, we're up to almost 6,500 members. And we have various membership levels that you can find on the website. As you can see below, most of the members are from the Anschutz campus, but that's no surprise. There's significant numbers, hundreds of members from Colorado State University, CU Boulder, National Jewish, etc. Now, the CCTSI administratively is located in the Vice Chancellor of Research office. That's Tom Flagg is our Vice Chancellor of Research. And you can see we're one of the 6 pillars, including the Chief Research Informatics Office, Basic Science Support, et cetera, and the CCTSI. So here is our leadership. Again, I'm the director. Tim Lockey's our DFA. Janine Higgins is the Director of Operations. We have a number of associate directors listed there. There's a contact at Colorado State University, Sue Vanderwood at CU Boulder, Chris D'Souza, and at the VA, Jane Roosh. Without going into all the details, we have lead investigators that are co-directors at our various hospitals. And literally there's well over 120 people involved in the administrative implementation of the CCTSI. This is our org chart, which can be a bit confusing, and I don't want to dwell too much on it other than to show that we do have an external and an internal advisory committee. We evaluate all of our programs. We have a dissemination and implementation portion to our research and evaluation. And we utilize a number of terms from the NIH for our different cores. And without trying to go through these names and explaining them, it might be better first to say that our leadership now is actually more females than males. Leadership includes people from School of Medicine, nursing, public health, and engineering. So this is not simply a School of Medicine program. This is the entire Anschutz Medical Campus. So maybe this is a better way to look at what our programs and resources offer. I'm going to go through selected programs. Really don't have enough time to go through every resource, but I will refer you to our website to get all the information you could possibly need. Suffice it to say, we have many education, training, career development programs. We have clinical research units and facilities. We'll hear more about that in a minute. We have a very active community engagement research program, dissemination and implementation research, team science training. We have a biostatistics core that's embedded in the Center for Innovative Design and Analytics that Nicole Carlson oversees in the School of Public Health. We have an informatics core, bioethics program. We have embedded in Dr. Ellison Lakin's regulatory office in the Vice Chancellor Research's office. We have a regulatory knowledge and support core. We have a variety of pilot grant programs. We're involved nationally in something called the Trial Innovation Network that I'll speak to in a few minutes. And then we have two special programs, one in innovation and entrepreneurship, and another early life exposures program run by Terry Hernandez, in which we have infrastructure to assist investigators with research in pregnancy, with placentas, with newborns, and basically to look at the effect of exposures prenatally and postnatally that may affect long-term outcomes in children as well as adult health. So in a nutshell, these are our programs, and let me speak to a few of them as soon as I show you our website. So this is really where you're going to get complete information, applications, a lot of details about our program. You can try to remember this or just Google CCTSI and we will be 1 to 20 in your list of connections. Our website really should be how you find information, applications, links to services, etc. This is where you can become a member very quickly. It only takes a few minutes. There's a quarterly newsletter that is written by Wendy Meyer, and you'll find Colorado Profiles, which is a way to find a researcher, kind of a Google platform for locating people at our university, and I'll demonstrate that in a minute. Our website and profiles really receive thousands and thousands of visits a month, and we encourage you to use them avidly. So this is what our website looks like. And these menus at the top, I urge you to click through them. Each of these lists numerous programs. And if you click on the program, you'll find out all of the contact and other information that you need. If you scroll down on this page, you'll see various buttons to push to get to some of our most popular programs quickly. But also very important, this is a button that gives you information on how to cite our grant on publications. Please do that. Our funding depends on our demonstrating to NIH and others that this large grant provides support for research that gets disseminated through publications. This is the button to click to become a member. And finally, Find a Researcher is a button that will link you to Colorado Profiles. You can also just Google Colorado Profiles and you'll find us easily. So what is Colorado Profiles? Again, it's a search engine by which you can locate investigators at the University of Colorado, all campuses who do biomedical or biobehavioral research. And you can locate us by keywords or last name. So if you type in a keyword, say biliary atresia, and then you click search, you end up with a ranked list of investigators who do research on biliary atresia at the University of Colorado, ranked based on the people who fund the most, who publish the most in the highest impact journals and who have the most grant funding. And if you clicked on a name, and let's just click on my name, you will get to an individual page that shows my profile, which I'll show you in a second. You can also get to an individual profile by just putting in the last name or the first name of the investigator. And then you will find a page that lists their profile with contact information, their grants, their publications that are automatically uploaded twice a week from PubMed, and then a variety of networking diagrams that are automatically formed. So again, this would be the page for me. Here's my contact information. Here's awards and honors that you have the opportunity to edit your profile. There's a button here somewhere that says edit my profile, and that allows you to add things. But if you click further down the page, you'll see all my publications, my grants, etc. So all of you have a profile that's pre-built. You can add your picture and you can add other information. I encourage you to do that because the more information in that profile, the better utilization by others who are looking for you. They'll know who you are. So let's move on to some of our other more popular resources. So our CTRCs, Clinical Translational Research Centers, are our research units. And Wendy Court oversees these. Janine Higgins, as the Director of Operations, also plays a major role in maintaining these operations. And as you can see, we have research units at UCH, at Children's, at National Jewish. There's one at CU Boulder. And we have a mobile group that does perinatal research. Most of these institutions have inpatient and outpatient facilities. And I should mention that we do not charge for space for research studies, except if they're industry sponsored. So this is for both inpatient and outpatient. We also have expert research nursing. So these are not study coordinators. These are nurses who do infusions, collect specimens, make other measurements that are highly specialized. And they function again in our inpatient, outpatient, and mobile teams. You can hire them. It's a subsidized fee-for-service charge. We also have a very active bionutrition core, a metabolic kitchen that prepares thousands of meals for research studies each year. The kitchen has been relocated now to the Anschutz Health and Wellness building on campus. We also have a whole room calorimeter for studies in adults over at UCH and variety of body composition analyses. We offer research vascular ultrasonography and echocardiography. We also have a number of core laboratories that do specimen processing, but also perform analysis of over 300 specific research tests, not typical lab tests, but research tests such as cytokine panels and vitamins and inflammatory markers, et cetera. And you can see the prices for every test and its methodology on our website. We also offer micro grants, which means $10,000 a year for up to 3 years for junior investigators and occasionally for more senior investigators to assist them to buy our services, because these services that I mentioned are mostly subsidized fee for service. So for fellows and junior investigators who may not have the funds to purchase those, we offer these micro grants, which are very simple to apply for. We review all the protocols, and at any given time, when you add all of our research units together, at least 200 unique principal investigators are conducting research on well over 500 protocols, resulting in sometimes up to 15,000 patient visits per year in our research units for strictly research studies. Here's our medical directors: Tom Campbell for the adult or UCH CTRC, Phil Zeitler for the pediatric one, Chris Baker, perinatal, Don Leung at National Jewish, and Krista Souza for the CTRC at CU Boulder. And here's how you get in touch with them. So I did want to mention something about our adult CTRC. Those of you on the Anschutz Medical Campus may have noticed a new building called the Anschutz Health Sciences Building, which is ready to open in a couple of months. It's now being filled with various programs. This is the artist's conception of what it looks like. And I'm very happy to tell you that the adult CTRC, as well as all of our administrative offices for the CCTSI, the exercise research facility, our infusion lab, and our core lab will be moving over to the 6th floor of the AHSB on April 1st. And shortly thereafter, we will be open for business. We have roughly 30,000 square feet, including large procedure rooms, negative pressure rooms, a 5-chair infusion suite, and we will be using the dedicated research pharmacy that's being placed on the 1st floor of this building that some of you have already heard about. But because this facility is no longer in University of Colorado space, because of that, the facility needs its own research pharmacy, and we're going to be using that. So we're very excited about it. This is what it looked like. This is what it looked like last week. And as I said, we move in right about the 1st week in April, and our programs will be open shortly thereafter. So we're very excited about being part of this really wonderful facility on campus. Our Pilot Grant Awards program is perhaps our most popular program. We have 5 different pilot grant programs, one called Colorado Pilots, Child Maternal Health Pilots, Community Engagement Pilots, New Methods Development Pilots, and a special pilot grant that's a collaboration between CU and CSU. For that award, you need a principal investigator at both sites. Throughout the year, we have roughly $900,000 available for pilots, and they're given out in aliquots of $20,000, $30,000, and $60,000 levels. I should say that starting in 2023, we will probably be increasing the $20,000 and $30,000 levels to $40,000 or $50,000. For various pilot grant programs, you'll see that we issue RFAs, and the letter of intent is usually due in August, deadline for submission September. We review these in November and December, and generally the startup is someplace between January and April, depending on IRB and IACUC protocol approval. And we track these very carefully once we give out these awards. These are designed to be one-year awards. By the way, Natalie Sarkova is the outstanding director of all of these programs. We track the return on investment, and I'm happy to say that we roughly see downstream grant funding from these pilot grants of 15 to 1, $15 of grants for every dollar of pilots that we award. So we think there's a very successful program. I should mention that $500,000 of this 900 actually comes from the Dean of the School of Medicine, who contributes to this program.
Ron, sorry to interrupt. I was just going to say your slide did not advance. We're now seeing the pilot grant awards.
It just advanced?
It just now advanced, yeah.
Oh, I'm sorry. I thought it advanced. So this basically summarizes what I just said about the different names of the programs, the money available, letter of intent, and there's a very nice picture of Natalie Sarkova. This advanced, did it, Tim?
Yeah, translational informatics.
Great. So we have a very active informatics program. It's now co-directed by Tel Bennett and the new Chief Research Information Officer for the campus, Melissa Hendel. We are the administrators for REDCap that many of you use for research studies. You may not realize it, but we have over 9,000 users and over 6,000 active projects. We also were very involved in setting up Health Data Compass and remain very involved in that. That's the enterprise-wide research data warehouse. I told you before, we administer Colorado profiles, and we have a variety of other software programs that allow us to be efficient and regulatory compliant with scheduling patients, measuring lab tests, et cetera. We also are involved with data delivery and cohort discovery through Trinetics, Compass, the data warehouse, and 2 other mechanisms. And finally, we also have a variety of applications that are available to help with review of grant and education programs on campus. Now, one of the recent involvements of the CCTSI over the past 2 to 3 years has been our involvement in this new national collaborative. It's called the National COVID Cohort Collaborative, or N3C. Melissa Hendel is actually one of the originators of this program, and Tel Bennett has been very involved. I think you may have heard about this already, but just briefly, it's a centralized secure portal that hosts national patient-level COVID EHR data, and it has the statistical tools and programming capabilities to allow all of the analysis to occur in this enclave. And Children's and University Hospital have been involved in this from the start. There's a lot of very unique aspects about this program in terms of data harmonization, et cetera. But let me just tell you that as of February 11th, this website now had data from 70 sites, 12 million people, of which there's over 4.3 million cases of COVID. The rest are control patients. There's 13 billion rows of data, and you can read all of the rest of this, 2 billion medication records, 659 million patient visits. So you can see all of the rich resources that are in this enclave. Many papers have been published, but many more are being written by various working groups. And you can get to that by accessing the website, the N3C Enclave access. You can also contact Tel Bennett if you want to get more details, and he can help you put together the team that could analyze data. There's already a variety of working groups that specialize in different types of diseases that are looking at the data. There's a video on YouTube. Again, when you get these slides, you can click on it, but it gives you some of the background. And this has really been a wonderful resource now for understanding real world data in real world time about COVID. So we also have at least 14 education, training, and career development programs. I can't say enough about the job that Dr. Lisa Sakudo has done overseeing all of this organization. Obviously, each of these programs has its own directors, but Lisa oversees our entire platform. We have summer programs for minorities. We have a T32 called a TL1 pre and postdoctoral training program. The master's and PhD in clinical sciences is part of our program. We also have a K-12 research scholar program that now supports 8 or 9 K awardees that are administered internally. We support the clinical faculty scholars program that Ann Libby oversees, and a leadership program as well. We support the Colorado Mentor Training Program, a K2R Transition Grant Review Program where Maggie Weirman organizes study sections to review our awards, first our grants from K awardees, but from anybody else as well, and really does an NIH-style study section review 6 weeks before the NIH deadlines. We do a similar thing for K award applications, and Paul McLean organizes this. Really would refer you, if you have any junior investigators who want to submit K awards, to look into utilizing this service. Jane Roosh runs our research studios, which I'll mention in a second, as well as the Innovation Core. Teaming is a program run by Jenny Cross from CSU, where she trains early career investigators into best practices for putting together and overseeing a research team. And the newest kid on the block is an effort on our part to assist investigators with learning to communicate their science to the public. We all know how much disinformation has been out there during the pandemic, and it really is incumbent upon us to learn best practices on how to communicate complicated scientific ideas to lay people. And Camilla Sasson has run this program. I'll give you a little bit more information about that in a second. Here's just a picture of Paul and Jose Castillo Mencia, who run the PreK grant review program. And without going into too much detail, you go to our website and really encourage your future K awardees to utilize this in order to get information for their grant, and then a study section, a mock study section review, which occurs 3 times a year, provides innumerable benefits to those. And again, the next letter of intent is April 18th, which would then put them in line for the June NIH cycle. We also have the K2R Transition Program. Again, Maggie Weirman runs this, and this is similar where we ask K-level awardees or those without K awards who are submitting an R-level grant to submit it 6 weeks, 4 to 6 weeks before the NIH or other deadline, and then our mock study section reviews it. So we also have something called research studios that are a little bit different. For Research Studio, Jane Roosh and Ellen Prechovska will assemble expert panels of 4 to 6 experts, almost all from our campus, but other CU or CSU campuses as well. And they are assembled to provide targeted advice about a research project, grant application, idea generation, and during a 90-minute consult session. And these can be T1 or T2 or T3 and T4 research topics. The discussion is something that the investigators find very beneficial. And these are the type of consults that we do. Sometimes it's just about how do I generate a hypothesis for this biomedical problem, or can you help me with my specific aims for a grant application? Or I got my grant review back, can you help me respond to the comments, et cetera, et cetera. And Jane has done a great job with Ellen in organizing this. We do these several days a year and do 4 to 5 studios per session. So here's the dates. February 15th is the next session, then followed by March 29th, and then June 21st. Again, there's 4 to 5 of these 90-minute studios on each of these days. And to get involved, you can contact Dan Holtrup. Again, all of this information is on our website. We have another program that we instituted about 5 years ago called the Innovation Core at CCTSI, or I-Core at CCTSI. And what I-Core is now overseen by Kathy Bodine, whose picture is there. And in I-Core, what we do is enroll teams of faculty, staff, or students who have a discovery or a health innovation idea that they'd like to learn more about, bringing that to a final product and commercializing it. And I-Core is the early stage customer discovery phase of looking at the potential utilization of your discovery as an eventual product. So there's team-based short courses. The teams are guided through the early stages of customer discovery. And then we test the business model hypotheses by reviewing each person's business model. The next spring session will be held April 7th, 8th, and 29th. And this is currently being done virtual or in person. We haven't decided for the April session which we'll be allowed to do, but hopefully in the near future, these will all be in person again. I-Core does not cost you anything, and everybody goes through the program said it was very, very helpful. And then they can launch into some of the other innovation stage programs in our innovation ecosystem on campus. I've just outlined in red here 3 of the programs in which the CCTSI participates quite vigorously, and many of these other programs are overseen and collaborate with CU Innovations, who we work closely on I-Core with. Here's the Communicating Your Science to the Public program. Again, Camilla runs this, and she's really got a lot of experience speaking to the media. We offer this quarterly for up to 30 per session. The sessions fill in about 5 minutes, so I encourage you to keep your eye out for the RFA. Here's the various workshops. And again, we've gotten outstanding response of those who took the course and believe it's really helped them learn how to communicate their science better. We also have very active community engagement and research programs. This is a major emphasis of all CTSA programs. And I would argue we have maybe the most active community engagement programs on campus. For instance, we have 11 community research liaisons who live in communities that they belong to, and they help our investigators understand those communities and assist them with implementation of their research in a community setting. This is a bi-directional activity that the investigators undergo about learning about culturally appropriate ways to address the community, but also listening to them as to what they believe their major biomedical research challenges are. We also have an immersion training program for investigators. We have research readiness certification for community-based organizations, community engagement consults like our other research studios. We have a special pilot grant program. We have a program in boot camp translation, which means we teach investigators and teams how to message their research and their implementation for dissemination implementation research, how to message it appropriately for specific communities. And finally, we have an introduction to CBPR for community academic partnerships, and much, much more. I encourage you to go to our website and learn about these programs. We're also part of the Trial Innovation Network. This is basically a network that utilizes the CTSA National Consortium to provide some centralized resources regarding a single IRB, study design, et cetera, for multi-site studies, and generally NIH-funded multi-site studies. An investigator can request some assistance with a single service or the entire study life cycle. And we have a hub liaison team, which you need to contact first. Adit Ginde is the director, and you can see we have medical directors and others. The lead contact is the project manager, Aaron Mobley, and he's at CU Anschutz. We get various requests from the Trial Innovation Network for us to find local investigators for a specific topic to participate in multi-site studies, and vice versa. If we have investigators here that are the PI on a multi-site study, we can use the Trial Innovation Network to help locate sites for your research. More information again on our website. Allison Lakin's Research Support Center office offers many services. Again, the CCTSI Research Knowledge and Support Office is embedded into that office, and they will assist with things such as FDA submissions, IRB submissions, clinicaltrials.gov records, research agreements, et cetera, et cetera. So we would refer you to their office, and again, linked on our website. And we also have a very active program in promoting diversity, equity, inclusion, and the elimination of systemic racism. The CTSA program nationally has taken this on as one of its major goals for the next few years. So we have done a number of local things, such as posted information about the COVID-19 impact on Latinos in our community, a fact sheet that's used by many organizations and the media. We've also formed our own committee, and with that, we've put some statements on our homepage of our website. We also are examining our hiring practice, surveying our staff. We have mandatory training for all of the CCTSI staff. And we are even considering a mechanism to potentially train all clinical research coordinators on campus in DEI and social justice. I want you to know everything we're doing is coordinating closely with Regina Richards' office, the Vice Chancellor for DEI and Community Engagement, Dominic Martinez, and others. So one thing I wanted to mention is that I told you before, we are funded every 5 years, and our current 5-year cycle ends in May of 2023. So we are in the process this month, next month, up until May 13th, of putting together our grant renewal. And NIH decided this year, instead of one very large grant that we were submitting each 5 years, that they've broken this down into 7 grant applications. So we have teams working on every one of these applications. But the good news is that the main grant, which used to be called the UL1, now it's called the UM1. That's not important. But what is important is that that can now be funded for 7 years instead of 5 years, which gives us more continuity, and we have to spend less of our time reapplying. The other 6 awards, though, are 5-year awards. So as I said, a lot is going on right now. You may not see many of us for the next couple of months. We'll be working on this application, but we're very excited about submitting it and then moving on to the next phase of the CCTSI. So let me just summarize by saying we're really here to help you. We want to support your clinical and translational research, whatever type it is. I urge you to become a member, to become familiar with our website, use profiles often to locate collaborators, mentors, even an expert that you may want to ask a question about a certain topic, etc. And please cite our grant numbers on all of your publications. And with that, I am going to open this up for Q&A, and let me stop sharing my screen so we can all see each other. And that's, whoops, Tim Lockey, who's who I see. I don't know if the rest of you are seeing Tim. But let's see if we can look in the Q&A first, and then we'll look in the chat. And let me either answer the questions. Janine Higgins has joined us, our Director of Operations, and Wendy Meyer. So the first question is it possible for you to email us a copy of your PowerPoint slides? And they gave me their email. So Wendy, are we able to email these slides to everybody who registered? Is that right?
Yep, I can email them to everyone who registered, or actually maybe who's attending today. And we can also put them on our website and make people aware of that, where it is on our website.
So we will do both of those, and we encourage everybody then to look at the slides. Looking at the chat, will the CTRC be available again to non-COVID studies? So I'm going to let Janine answer this. She typed in an answer, but I'll let Janine answer this to everybody.
Yes, we have no current restrictions in place. So during the COVID research shutdown and restart, we phased back from essential research, which was really only COVID and life-saving studies. But since the end of 2020, we have been open for all IRB approved research. So we're available for all research types.
And let me just mention that we also now have 2 negative pressure rooms, which can be utilized for some infectious disease studies. That's actually where we do our cannabis studies and some other studies that require negative pressure rooms. So that's going to be in the building behind Janine and myself. So keep that in mind. Let's see if there's other questions here. Don't see a lot of them there. Anybody who wants to type in a question, please feel free to do it in the Q&A. That might be the best place to ask your questions. Give you a few minutes to do that. I hope you all have access to the Q&A. It's on the bottom. Janine, did you have any specific, while we're waiting for questions, Janine has been holding town halls about the move to the Anschutz Health Sciences building. And Janine, maybe you want to tell us when the next town hall is and how that information can be made available to everybody?
Sure. Wendy just added to the chat the link to register, and it is next week. It is on February 24 at noon, and you will need to register in the link that Wendy just put into the chat. And that will provide you with the latest details that you will need to know about the CTRC. I would also, if you do CTRC studies, encourage you to go to the Move webpage on the CCTSI website and sign up for our study team tours and orientations. They're taking place for 2 weeks from March 14. Because of COVID policies, we are strictly limited to 10 people per tour. So you do need to sign up for one of those time slots, which is on the CCTSI website. If you just click CTRC Move.
That's on our homepage. Thank you, Janine. So a question about whether we would be proposing any new cores in the new grant. So let me first say that the RFA, the FOAs for these 7 different grants are in general quite specific about what we're allowed to ask for, but also we can propose some specific innovation research programs that build on our strengths. And currently our 2 optional functions are our early life exposures program that used to be called child maternal health research, and our innovation ecosystem that includes the ICOR program. We are going to expand each of those and double the funding for each of those in our new grant application to have more ability to fund Product development, Mike Hollers will be involved in that, as well as Kathy Bodine. We also are going to expand our early life exposures program and maybe go back to our prior terminology of maternal and child health research or some other terminology, but Terry Hernandez is still going to direct that. And we're working with the precision medicine pediatric team and our informatics group at Children's and in the Chief Research Informatics Office to develop new automated phenotyping, both pre and postnatal, that we think will be very exciting. So those are some of the new innovations that we are going to put in the new grant. Another question, would we be able to get access to patient information data from the control group for non-COVID research? So my guess is this is a question related to N3C, that National COVID Cohort Collaborative, and there's much data in there of non-COVID patients, but I must say, I don't know if they would allow research that does not involve COVID. I don't know if they'd allow you to utilize that database, but I can tell you that Melissa Hendel is the person to ask, or Tel Bennett. And either of them, you can find their emails here. Melissa's last name is H-A-E-N-D-E-L, and Bennett is B-E-N-N-E-T-T. So why don't you ask them the question? I don't believe they're on the webinar, but they would be able to answer that question. It's a very good question because there's data on millions of patients who don't have COVID, but were admitted to the hospital and turned out to be COVID negative. Interesting question. Next question, when are you considering to train all the clinical research coordinators in DEI and social justice? What will that training look like? And Cheryl asked that. Well, that is a great question because that is not a small undertaking. Allison Lakin's office is estimated we have at least 600 study coordinators, clinical research coordinators on campus. And as most of you know, DEI and social justice training is most effective in small groups, not hundreds and hundreds of people at the same time. So we're having discussions with Allison Lakin's office about how we might be able to do this in a fashion that was meaningful. Currently, as far as we know, there is no formal training for our research coordinators, but as we also all know, they are the person who's in contact most with research participants. They're in many cases the face of our research to community members, and we think would be a grave oversight to not make sure that they are fully trained and knowledgeable about best practices for inclusion, et cetera. So we're working on that. I'm sorry, we don't have an answer for that yet. Next question, I may have missed this as I had to join late, but the CCTSI holds RCR trainings. We'd be offering these during the summer of 22 or the fall of 2022. So that is the responsible conduct of research. And again, that was done through Allison Lakin's office. We were involved in that. And I don't know, Janine, do you know if that is currently being held? I didn't think it stopped. It went all virtual.
Yeah, there's a series of trainings, and they are advertised in the bulletins that do come out from time to time. You'll get emails about those. Those trainings are ongoing and will continue to be ongoing, again, remotely.
Yeah.
Except for the vital signs. The vital signs training is still in person, obviously.
So we're talking, I think, about two different trainings. There's trainings for the clinical research coordinators. I think this is training for investigators and trainees in responsible conduct of research, which was a series of meetings. They used to be at the Humanities Center, and then they switched them to being virtual. And I thought they were continuing to be ongoing. It was generally once a month, and over the year, they'd cover all of the topics in RCR.
Yep.
So
they are still ongoing.
I believe they're ongoing. Okay, long question. Thanks for this town hall. Who are potential leaders on reducing maternal mortality from CCTSI in Colorado? Counts of pregnancy-associated deaths rise. Since 2019, 9 states have been funded to reduce maternal mortality, a line item for Maternal Health Innovation Program in fiscal 2022 can fund 16 more states. So we do have active groups in the School of Public Health and in our Department of Obstetrics and Gynecology working on this specific topic. We actually, with them, helped submit a grant for an administrative supplement several years ago. We can find out for Dr. Lee or connect you with the people involved. I do want to make sure you understand that leaders in the CCTSI don't necessarily lead the specific research programs. We lead our programs that support research, but we're happy to connect you with those individuals. And actually, I think Terry Hernandez probably would be our best contact, unless Janine, you know who the leaders would be that on campus. So
no, I would contact Terry.
Yeah. So Wendy, why don't we contact Terry and ask her to get in touch with Dr. Lee about this? But thank you for asking. And again, we view ourselves as a knowledge base for what goes on campus, in our hospitals, at CSU, at CU Boulder, if you're looking for collaborations. So we do encourage you to ask us questions like this about who you could contact about a specific area to help submit a grant. And several times a year, NCATS and NIH puts out requests for applications for administrative supplements to the CTSA grants that only we can submit. And many times they're about a specific area, such as this. And when we see those supplement notices, we then generally contact investigators on campus and assist them in putting the grant applications together to try to get funding in that specific area. My guess is we're going to see grants like that in diversity, equity, and inclusion and social justice over the next year. This is becoming a major effort by NIH to improve the diversity of its research-funded grant recipients around the country, as well as internally at NIH to increase their diversity. So I suspect we're going to see many more grants like that. I can give you one example. Last year, we were successful in submitting a diversity additional KL2 award. So this is like a K23 award for one of our local investigators. And she is now a member of our KL2 research program. And we are planning to submit another one of those grants this year by next November after we submit all of our grant renewal applications. So at various times during the year, there are other opportunities that, because we have a CTSA award, that are become available to us. And again, we seek out investigators on campus that would be the PIs on some of these along with us. So I hope that answered your question, Dr. Lee. And I don't see any other questions in the Q&A. Did you see anything I missed, Janine?
There's one in the chat, Ron, about pilot awards. Do you see that? The last one in there from Paul McCann.
Yeah, let me open the chat. So it says that there are limits to the number of pilot awards per person or group. So at any given time, you can only have one pilot grant award. So that's one of our rules. And the reason is, as it is, we get hundreds of applications. And we think that we want people to put their best grant forward. So if for the PIs on the pilot grants, we allow you to submit one per program per year. However, we don't limit numbers of awards from a research group. If different members of a group have different ideas, they can certainly submit grants. Obviously, if there's major overlap, then that's we may not review those grants. But there is no limit beyond one per investigator per year. It looks like Dr. Lee said she'd contact Terry Hernandez. And that's great.
There's one more question. It's gone to the answered. It says any guidance regarding when in the research process to reach out, but I'm not sure for what. So if that person could add a bit more context to what they are reaching out about, we'll be able to help you.
Yeah. Oh, sorry. Kathy has her hand up to say something as well.
Oh, okay. I can't see everybody. So Kathy, please, can you unmute yourself?
I'm sorry, Ron. That was an accident on my part. Didn't mean to do that.
Oh.
All right. Well, anyway, nice talking to you. So we're waiting to see if there's any more questions. And in terms of that question about where to start in terms of reaching out, we recognize that orientation to our campus can be complicated as to any other new campus for new faculty or fellows. And each summer, there's a new faculty orientation session put on by the School of Medicine. I would assume other schools do the same. And either Janine or I give an orientation presentation for 20 minutes about the CCTSI, and we encourage new investigators to contact us if we can help them find their way through our infrastructure to know where to start. But I can tell you that Allison Lakin's office is really serious about developing some visual pathways for investigators. So it's as clear as can be as to how you get started and who you need to contact at which stage of your research. Most of us, though, within the CCTSI can just do that with you by email or by phone once we know what you're really looking for. I would also suggest you go into your own department. They may have resources and investigators who do your type of research as well, who can help you with how to navigate the system. But we recognize that there is a need for navigators, if you will. I should tell you that in the past, we did have some people hired as navigators, and they were underutilized to our surprise. But we'll look into this again for the next grant renewal.
I'd also like to add that if you send a question through the CCTSI website, our webmaster is really great at making sure those questions get answered. A lot of them come to me, or he directs them to the person who can help you very quickly, usually within an hour. So don't be afraid to use it because you don't know who it goes to. We do look at those and respond very quickly if you need help.
Thank you for mentioning that, Janine. Another question says, if we're doing research and it feels like it is going fine, when or why would we reach out? Sorry, I don't have more specifics. Not exactly certain how to answer that. If ever, if it's not broke, don't fix it. But I think most investigators sooner or later can use some of our resources or our help, and we're available. If you don't need us, that's perfectly fine. We don't require anybody to use our resources. Edith Silva's asked, can you direct me to the COVID document you referenced during the DEI section of your talk? I missed the name. So that should be on our website. I'm afraid if I try to open our website, I may lose the Zoom meeting. But if you go to the community engagement tab on our website, and it's either under the menu or one of those blocks that I showed you on the home page on our community engagement website, I know is the link to our DEI statements. And we also, I believe it's still there, right, Janine, on our homepage, right below the top picture, one of those large push buttons says diversity, equity, inclusion. And if you click on that button, it takes you to the same page. So you should be able to get to those statements.
I just posted it in the chat, so you can just click that link and you'll get there right away.
Great. About Us DEI. And Chris Caldwell added that as well under global navigation. let's see. The anonymous, because you could mentor someone else. That was, not sure
Maybe that's to do with the pilots. Can you be a mentor? We originally did have language in the pilot RFAs that said you could only be a mentor to one recipient.
Yes.
Please check the RFAs. We did remove that that language. I think last year, was it Ron, or the year before? Yes. But every specific RFA for each of the pilot programs will stipulate that, and we have removed that barrier.
But again, you can only be PI on one, but you could be a mentor on multiple pilots.
Yes.
Yes. Okay, it looks like most of the questions have stopped.
There's another one.
Sorry, they keep coming. Can you apply for pilot in 2 consecutive years? If you don't receive a pilot in 1 year, you can apply the next year. But I believe if you receive a pilot, you cannot apply while you're receiving the pilot grant, because in the second year, the consecutive years, you would be then funded for your pilot grant. So you have to wait until you finish that pilot grant award. And again, part of the reason that we've got some rules in place are just to make sure that we make these limited funds available to the most investigators. Remember, pilot grants are designed to obtain preliminary data for a grant or answer a relatively small question, not to fund your research year after year with back-to-back pilot grants. So we try to make sure that if you have a pilot grant, concentrate on that, and you should hopefully get preliminary data then that you could use to get larger funding. That's where that follow-on grant funding ratio 15-to-1 comes from that I mentioned. But if you don't receive a pilot 1 year, you can certainly apply the next year. And okay, I don't see any more questions or chats, and it's already after 1 p.m. So I'd like to thank everybody for your attendance, and to Wendy, Tim, and Janine for helping with some of the questions. Please feel free to contact us whenever you need us, and we look forward to working with all of you. I'd also like to thank Tom Flagg and John Riley, both of whom I report to as the director of the CCTSI, for their support of our programs. And we wish you a happy Thursday, and drive carefully in the snow today. Bye-bye.